Hello, everybody, and welcome. Thank you for taking the time to be with us today. We actually have registrants from across the country, which is super exciting. So my name is Marla Owens. I am the Clinic Outreach Manager for Amen Clinics here at our Chicago location. This is just one of our 9 nationwide locations, with our 10th opening soon in Florida. Wow. And before we get started, for those of you who are not too familiar with Amen Clinics, we use a multimodal approach to treatment that uncovers the root cause of our patients' issues that aren't normally discovered by traditional psychiatry. And we look at our clients' brains using brain SPECT imaging scans to measure the blood flow and activity in the brain. And this allows our doctors to properly diagnose and treat. And throughout the presentation today, please feel free to use the chat box for any questions that you may have. And just know that each and every one of you will get an email of this recorded webinar after the session today. And I now have the pleasure of introducing my special guest. Her name is Dr. Ingryd Lorenzana. Dr. Ingryd Lorenzana is a neuro-optometrist based in Schaumburg, Illinois. And today she's going to be talking about her practice, her affiliation with Amen Clinics, the importance of brain health, the importance of eye health, concussions, vision processing, and how all of these things tie together. So with that said, Dr. Lorenzana, welcome to this session today.
Thank you so much. I'm very excited and very grateful for the opportunity to share with you guys today.
And we're excited to have you. So I'd love to start, Dr. Lorenzana, with you telling us about your practice in Schaumburg, Illinois.
So my practice is a specialty practice, neurooptometry. The main focus of my work is centered around how the brain uses the visual information that comes from the eyes. There's this myth that if we can see clearly 20/20, everything is fine. But what we don't realize is that the 20/20 piece is probably the smallest piece of our overall visual function. The bigger percentage, the bigger component, the more important component of vision is once the eye detects a clear image, which makes it the 20/20 piece, what does the eye do with that information? How fast does the eye transmit that information to the brain? Because it's in the brain where we process that information and we give it meaning. And so we think we see with the eyes, but in reality, we see with the brain. The eye just captures the information and sends it to the brain so that the brain can then work.
Wow, that's fascinating. And how long have you been in your practice in Schaumburg?
So in my practice, actually, this is, oh my goodness, it feels like yesterday, but I've had my practice now for 17 years.
Okay.
And I've been practicing for 27.
Wow. Thank you for sharing that information. And Dr. Lorenzana, how did you first come across Amen Clinics, or how did you hear about Amen Clinics?
So I have a very personal, it started out as a very personal connection. Okay. Throughout my academic life in high school and in middle school, I had a lot of trouble with reading, and I couldn't remember what I read. And then by the time I got to college, I then started to have more problems with anxiety. And it wasn't until I got to optometry school that I was diagnosed with a vision problem. And my vision problem was that when I read, my eyes didn't work together as a team, and there was a condition known as convergence insufficiency. So my eyes were not coming together enough that when I would read across the page, my eyes would struggle, and that would make the words move on the page. And I was treated for that, and that helped me a lot. It actually was very instrumental in allowing me to graduate from optometry school. But parallel to that, my anxiety was still going on. I was actually having a lot of insomnia. And in one of my insomnia nights, I was watching the Larry King show, and Dr. Amen was on there, and no pun intended, but it caught my eye. And I love the fact that he said, change your brain, change your life. And I started to follow, and I started to read, and I did wanted to go see, and I even sought out to seeing him. At the time, he only had 2 clinics, and they weren't accessible to me, so I just continued to follow him. And it wasn't until in 2017 when he opened up the clinic here in Chicago that I said, I'm there. And I went through his brain certification program. And as part of that program, I had my brain scanned. And it was, I still get very emotional about it. I think the biggest thing that I got from the brain scan was the validation that I guess through my struggles of reading and my anxiety and my mood swings, I had personally internalized that people perceived me as a crazy person, or sometimes as a lazy person, because I couldn't always follow through with things. I remember I had a really bad, no, it didn't matter how well I planned, I would always be late to things. And it looked like I was irresponsible. And so those perceptions walk away with them, that where you start thinking, maybe I am lazy. Maybe I am not as smart as I think I am. And it was just so validating to see that my brain image, I didn't do it for the intention. I was just curious what's going on with my brain, to be honest with you. I've had some thyroid problems, and I thought, let me see what my thyroid's doing to my brain. That was kind of like my looking into. And it actually showed the damage, that I had occipital lobe damage. It also showed that I had inferior frontal lobe damage. And I went back, and the whole thing of it was like, it looks like here, like you've had some sort of traumatic event. I went back to my mom, and I said, did I ever, get hurt? And she said, yeah, don't you remember when you were 7 years old, you fell down and you broke your skull? And I actually do have a scar here. I fell down another time on a separate occasion and got hit here with a brick, and I have a scar on my left eyebrow. And then I have also a scar in my occipital lobe, but I had forgotten. And now, knowing everything that I know about concussions, and how concussions has all these different trajectories of symptoms, it really is. It wasn't just my eye muscle imbalance. It was really just an undiagnosed brain injury that I had been living with all my life. And so I've been on a personal journey of trying this treatment and trying that treatment and trying this and trying that. And I think that resonates with a lot of people, because especially with brain injury, there isn't one thing that's going to help you. It's a collectiveness of things approach. And so it was that validation that it gave me. And because of all my mood swings and my anxiety, I honestly was very alleviated, because I even started to think, well, maybe I just have a psychotic disorder. And now I was worried I'm going to hand this down to my daughters. So it was very liberating, and it was very validating. And I have always been, as part of my personal journey, very adamant about health and sleep. And so now getting my brain health certification through the Amen Clinic, combining it with my brain scan, was just like, I'm an advocate for the Amen Clinic and the work that they do. And it's just putting it all together that really, really has so much value. And I see that with my patients too. I've become where I'm Dr. 8, Dr. number 9, because when one doctor cannot help that patient, they're going to keep looking for a doctor until they finally find someone to help them. And I actually, right now, I have a patient where I'm Dr. number 18. And I remember feeling at first like, why me? Why me? Why me? And now I'm grateful of the why me, because I finally gotten to the point where I recognize it is my personal journey that gives me that personal connection to not just see my patients as a patient, but understand them from their perspective, that they're looking for answers, they want validation, they're looking for hope. And that's what the Amen Clinic did for me. It validated me. And so it actually empowered me to, my self-esteem was like, maybe I'm making this up. And so now I'm even more empowered to help others, that people keep, I have this problem, I have that problem. And, very often when doctors don't know what's going on, they might be a little bit dismissive, not intentional, but just because they don't know what else to do. The Amen Clinic has been phenomenal in that regard of, here's the solid evidence, here's the evidence base of what's going on in this brain. And it's been immensely valuable for myself personally. And now I offer that to my patients as well.
I'm getting teary-eyed myself right now. That was an astounding and very personal story. And I very much appreciate you sharing all of that information with everybody who's watching and listening today. And I'd love to elaborate on a few key points that you made. I heard concussions several times. And Dr. Lorenzana, we see individuals coming into the clinic post-concussion on a daily basis. So can you talk about what you see in your practice in terms of concussions, in terms of brain health, in terms of vision processing, and how they all tie together?
So the very first thing to, I think, have an understanding of is the relationship of the eyes to the brain. And again, I think I made the point already, that the comment already, that the brain works based on the information it receives. And so 90% of that information, now the neuroscience is finally validating that 90% of the information that goes into the brain goes through the eye-brain pathways. And so for that reason, vision and the brain are one and the same. And when I look at it, and I know I'm biased because I'm a neurooptometrist, but when you look at the numbers, 90%, it's hard to, dispute that. And so when I talk to my patients about that relationship of eye to brain, I talk about specifically those pathways that connect the information from the eye that leads into the brain. So the eye-brain pathways. And the way I explain it to them is, think about that is your personal internet. And so think about what happens in your regular work or in your school or whatever's going on when your internet doesn't work and you need to get data through. If you're putting data through and the internet isn't working, what happens? You have to reload and reload and reload. And then what happens after that? Well, you might get frustrated because now you've been reloading and reloading and you still didn't get any work done. That same analogy happens when our eye-brain pathways aren't working. I need to read and I need to understand because I need to remember what I read because I have a test tomorrow. So I reread and I reread, but I can't remember what I read. So I'm going to read it again. I still forgot it. Now it's 3 hours later and now I'm all stressed out because I still didn't get through what I needed to read and my test is tomorrow, so I'm not going to sleep. So it's this really vicious cycle. And so understanding that integral relationship between the eye-brain pathways and the brain is number one. Number two is that, as Dr. Amen has very eloquently explained it, and I love that picture where he has the skull and he has a piece of butter inside the skull. And he says, think of the brain tissue as the same consistency as butter. So when you're getting that impact from the shock, from the trauma, your brain the neurons get jolted back and forth, they get squashed. So not only are you changing the structure, but even more importantly, from that pulling and stretching of these neurons, you're now changing the biochemistry of this brain as well. And so for that reason, the brain is very complicated. And so no two concussions are going to be the same. And from all this jugging and pulling and squeezing of neurons, we're going to have a diversity of symptoms. So it isn't going to be, it's just visual, it's just emotional, or it's just sleep, or it's just anxiety. It's an array. And so the big thing about concussions is evaluating what's the whole array of symptoms that we have. Do I have dizziness? Do I have headaches? Do I have neck and shoulder pain from headaches from the jugging of back and forth? And then again, the visual system becomes the key to finding that out, because since the neurons are such an integral part, the visual neurons are such an integral part of the information that the brain receives, evaluating how fast we're visually processing is really critical. And it also becomes really important as the accelerated method of rehabilitating concussions. And so it does require a team to help someone with a concussion, the physical therapist, the occupational therapist, neurologist, the psychologist, everybody. It does take a team, but I very often see it, which is unfortunate, that vision is the last thing to be checked, when in reality, the visual processing speed should be the very first thing to be checked, and it should be the very first thing to be rehabilitated, so that when all the other therapies are put in line, they will also have a greater impact and greater effectiveness, instead of doing it in reverse. I get a lot of patients who are post-concussions that are 6 months out, a year out, with symptoms that are still lingering. Maybe their double vision's gone. Maybe their dizziness is not there anymore. But now they come back because they can't pay attention. They can't remember what they read. They're forgetful. And so these kinds of things are really, really critical. Looking at that visual processing speed, it's that personal internet that really, really helps one evaluate, and two, becomes the accelerator in the recovery process.
Oh, that's fascinating, Dr. Lorenzana. And I'd love to tie in, I guess, a few additional key points here. So 2 things that I want to ask you about. And, you can answer one question, but I think they're going to go together at the same time. Okay. And that would be with individuals coming in who have been in a concussed state at some point in their life. What type of treatments do you offer for these individuals? Second piece of this, I'm sorry. Go ahead. And we can address them at 2 different times, but I really think they go together. I know that you have sent individuals into Amen clinics for brain SPECT scans for the results to come back to you, to be able to see them for yourself, to move forward with your patient's treatments. So I think these 2 statements kind of go hand in hand. So you've sent individuals to Amen clinics, and then your treatment plans for individuals at your own practice and how you utilize the scans that you see from us.
Perfect. So the big key piece I think that's unique to my approach is there's 2 components to vision. One is the eye muscles working together, which I mentioned earlier in regards to me. That's about 10% of vision. The other 90% of vision is how fast the information from the eye makes it into the brain. So that's that eye-brain pathway. And I mentioned in my particular case, I got diagnosed in optometry school that I had the eye muscle imbalance. I did traditional eye therapy exercises to help that eye muscle imbalance, and it helped me. But the piece that lingered on for me beyond that was the processing piece. And what was unique about me was that English is my second language, because I was born in South America. I came to the US when I was in 5th grade. And it was just so timely that I didn't know English. It was in 5th grade, and it was about 2 years after I had gotten my concussion or my brain injury that I started to have problems with my reading. And that lingered on. And so I was led to believe that I wasn't a good reader because English was my second language. So throughout middle school and even high school, I got assistance outside of the classroom, additional for me to read more and practice more. But by the time I graduated from optometry school, I'm still having these, I can't remember what I read. Couldn't organize. I could read something and then I couldn't organize my thoughts on paper. And I couldn't, I just couldn't do that. And I'm like, I think I know English by now. You know, I've been to graduate school, I've been to college. So I don't think English as a second language is really the reason anymore. I'm not buying it anymore. That's why I can't remember what I read. And, you know, that led me in a trajectory that's what allowed me to focus on reading and reading. And I didn't get there on my own. I have a great colleague who's also a neurooptometrist, Dr. Doug Steffi, who practices out in California. And he was the one who led me on the trajectory of, you need to look into this, the reading processing. And he specifically guided me on that path. We collaborate a lot. And I've asked him to also do the brain health certification in the Amen Clinic. And I think he's starting that process as well. But he's been very instrumental in guiding me in that piece. And of course, I've taken it to a next level. But the visual processing piece is really the core. And that's what's so unique about my practice, that bringing it back, I don't just focus on treating the eye muscle imbalance, but more importantly, I also treat the visual processing piece, that personal internet piece, which is the best way to evaluate what's going on in the 3 different areas and sections of the brain, and how that visual information then ties together with the other neurons that are non-visual, so that we have a strong neural infrastructure within the brain that very systematically, like how you and I are connecting here through this great network, we need a great network of neurons within the brain that communicate very fluidly, very cohesively with each other for us to do what we need to do. The role of vision in that network is that 90% of that network is visual. And that's why vision becomes such an integral part. So that's the uniqueness of my office as a neurooptometrist. The second piece to your question, well, how has that helped me with my patients? And so I recall very distinctly a particular patient where she came to me as a referral for lazy eye. She didn't have the ability to see 20/20 with each eye. She also did have a clinical finding that coincided with that inability to see 20/20. So it just kind of made sense. Oh, she has lazy eyes. And the previous doctors, I was doctor number 8, and the previous doctor had treated her for lazy eye, but they weren't having the success. They were focusing on that visual piece of eye muscles and eye tracking. So I came across and I'm like, well, I can do the visual processing piece, you know, that'll be my unique thing. And I started to do that as well. And she wasn't responding in the manner I would anticipate a lazy eye patient normally would respond in my previous clinical experience. But she also had a history of falling down. She was in a slide and she fell from the top of the slide all the way to the bottom. Her mom found her on the floor, falling back when she was about 5 years old. And so I said, you know what, this just doesn't add up. So I sent her to the Amen Clinic. And sure enough, very similar to my case, it showed she had occipital lobe area damage. And so now I had to change my trajectory and my direction of treatment, no longer treating her as a lazy eye patient, but now treating her as a brain injury patient. And so then, of course, started to change. The progress started to change. But having that SPECT imaging combined with the history was just, it just put the whole pieces of the puzzle together. I think it's just invaluable. And not only for me, but also for the parents as well, that here's what truly is going on. Here's why she hasn't been responding the traditional way that we would anticipate. And it's because it's different. And in my certification for concussions, I also do have an impact certified concussions in the pediatric and adult arena. In my certification through that, one statistic that really I was astounded by is that the majority of emergency room visits are traumatic events or falls in children under 4 years of age. And I was like, just astounded. Now, we do take a very thorough case history, and we've always asked about trauma, and parents very often say no, but knowing how to ask those questions about trauma very distinctly to pull and tweeze the information that we need. And so I very commonly now get those kinds of situations where I have a 12-year-old who they came to me because he's having trouble reading, and it definitely got worse now that the pandemic and they've had to do e-learning. It just really surmounted the problem. And mom said, he kind of already almost had problems anyway since he was in 2nd grade, but he did have an accident from an ATV kind of device where he fell and he landed, and then it got worse. And so the thing to remember, especially in the concussions with kids, is these are developing brains. We know that the brain doesn't fully mature in function until about 20 to 25. So a brain injury in a child is even more detrimental because this is a brain in development than it would be, any brain injury, of course, not to minimize it. Any brain injury is going to be impactful, but even more so in a child than in adult, because a child's brain is still a developing brain. And so making sure that we tweeze out all of those questions in the right manner. And that's what the Aberman Clinic has done for me. It's made me a better clinician to learn to ask those questions, but in an even more specific way to tweeze them out, because parents or patients, they don't know what I need to know. It's up to me as a clinician to ask them the questions that I know I need to ask them to pull the information I need. So I can't expect them to tell me, oh, he fell. I have to pull that out and then put all the pieces of the puzzle together. And the Amen Clinic has been instrumental in making me a better clinician, but also in completing a profile of a patient with more evidence-based science.
And I love that you just addressed that. That's a huge key part of an individual coming into Amen Clinics is a 2 full-hour clinical history. And most people think trauma and think a major car accident, a motorcycle accident, not realizing that trauma, as you mentioned, is something quite simply that the 4-year-old lost his or her footing, fell down the stairs and bumped their head, or fell off the slide, or bumped their head on the monkey bars while trying to slide down. So asking those key questions and being able to extract that information is imperative for the treatment plan for anybody moving forward. So the fact that you address that is a huge key factor in all of this. And Dr. Lorenzana, I've been to your clinic, and everybody in your clinic, patients, parents, your staff, everybody's happy and smiling and having fun. How do you make that happen for treatments? And I've seen kiddos that are having fun doing their exercises. They're having fun doing the readings on the walls. They're having fun doing their physical therapies. How do you incorporate the fun and with the kids, with the patients that you're treating?
I think that really comes from getting to know the patient and, customizing. So yes, we have a treatment protocol. We have a diagnostic protocol. We have a treatment protocol, but taking that protocol and customizing it to each individual patient's age, ability, and personal interests. I think that's where that comes from. And I also think that, for me, it comes from the passion that from my own experience, I have a greater understanding for patients. I was just having this conversation early this morning where a patient was lashing out, a potential patient was just lashing out. And I don't want this, or, it was just, and I very constantly have to train my staff. It's part of the training to say, you know what, when patients come to us, they're not frustrated us personally, and we got to remember that. They're frustrated at the situation that they've been living in. And so don't take it personal. And very often we see it where that's how they come in. But by the time they go through our treatment, they've gotten validation, they've gotten understanding through their healing, and then they leave a happy person. And so it's not because we do psychology, but it's because we understand what they're going through. And I think, again, I now personally understand the great value of my personal experience, how that's made me a better clinician, and in also training my staff to have greater understanding for our patients. And that's what happens, that, yeah, they come out, they come really, and it's just who they are, what they're living with in that moment in time. And I understand, okay, this is a person I can help, and walking them through their journey, understanding them, and, taking them to the other side.
And your success rate is obviously very high. I've seen your wall of fame up and down the walls of your clinic, of those happy, smiling faces, because they finally got answers, finally got results after trying so many different things. They came to you, they came to your clinic, they went through a treatment plan, and now they can continue living their life happy as they should be. So that was, I remember being in your office taking pictures. That was so powerful to me, seeing the smiles, the brightness, the shine from the patients that you treat, and seeing the outcomes of these individuals. Yes.
And it does. It does take a team, right? That's why we're collaborating with the AMN clinic, because it isn't my one treatment that's going to work. It's really figuring out where is this person and what are the things that are going to help them, and putting that for them together. So no two people may need the same thing, right? And so this work collaborating with other professionals has really, really been, I think, part of the success, that the more I collaborate, the more options I can offer to my patients. And maybe even if they come to me and I may not be the person that they need right now, they might need something else. They see great value in that it's not here because I want to give a service. It's because I'm really here to look at what's the best interest for you, whether it's me or whether it's someone else, another professional, really collaborating to help this person get the answers they've been looking for. And I think the validation that the SPECT imaging brings, to me on a personal level, but to patients, it's invaluable. It's the truth of it's a picture is worth 1,000 words. And so the SPECT imaging is of extreme value.
Agreed. It takes a team. And we love and respect, Dr. Lorenzana, your practice and your work. We have referred patients to you and have seen tremendous success with those patients. So thank you for opening them with welcome arms and understanding where they're coming from and the treatment that they need moving forward after getting their brain SPECT imaging scanned. So I know everybody has this big question right now, and we'll wrap it up right after this, but are you accepting new patients right now?
Oh, absolutely.
Okay.
Yes, absolutely. One of the things that we've been able to do with our time off during COVID is, restructure and retrain and expand a little bit. So absolutely, yes.
Okay, wonderful. And I do have both of our information included in the chat here. So if somebody is interested in your services, Dr. Lorenzana, what's the best way for him, her, the family to get in contact with you? Is that calling the clinic? Is that through the website? What's your best recommendation for that?
I think the website is probably the best place to start, because it gives you a great foundational background about our services and what we do. And it does definitely have our communications, our contact information on there. An additional thing that I really, really love to do, and I often, my colleagues would say, well, why are you doing that? Is I love to offer phone consultations to potential patients.
Okay.
Because I want to make sure that they're comfortable knowing that what we offer is what they truly need. And if not, then I can make, another recommendation. But offering those consultations, I love to talk to patients. So through the website is another way that we have the availability. You can schedule, you can request a phone conversation with me. Okay. That's of great value.
Okay, wonderful. Thank you so much, Dr. Lorenzana, for spending the time with us today. Again, all of you will be getting an email of this recording today, and Dr. Lorenzana and or myself will have all of your questions answered in the chat within the next week. And again, Dr. Lorenzana, thank you so much. We appreciate you. We respect your work. We love the collaboration that we have developed between your practice and Amen Clinics.
Thank you so much again for the opportunity, both to share my personal story, but also to help bring in more of my colleagues in to also, I love the brain health certification program, and I always encourage my colleagues that it's invaluable to help more and more patients.
Well, I think we can end this with, how do you know unless you look? Dr. Daniel Amen's famous saying, and it's perfect for this webinar that we just did now. How do you know unless you look? How do you know unless you look?
Yeah, exactly. How do you know unless you look?
Yes, let's look. So thank you again. Have a wonderful day, and everybody that joined us, thank you so much. I'm sure you gained some valuable information from this session today.